Thank you, Mr. Speaker. Most of my adult life, I have worked with and for people with special needs. First, I was a teacher of the hearing impaired. Then I taught a special education resource room. For a period of time, I was Director of Education for Arkansas Easter Seals. The last 13 years of my teaching career, I was a school psychology specialist for a large school district where I did testing every day of children with special needs. Therefore, I think I'm qualified to speak up on behalf of the most vulnerable citizens of our state, the elderly, the children, and yes, the disabled. Now, we all know that the private option does not cover these groups. The private option covers able-bodied, working-aged adults. But the problem is, expanding Medicaid to those who can work threatens the care and well-being of those who cannot, for whom Medicaid was designed. The Medicaid safety net, before we ever created the private option, was already a little ragged. Access to care is very limited, and health outcomes for Medicaid clients have been proven to be poor. The private option waiver application stated that our network of Medicaid providers was already at capacity. This means that we are stretching a safety net under an additional 250,000 Arkansans who are, and I repeat, able-bodied, working-aged adults. In other words, the private option is forcing our most vulnerable members of society to compete with 250,000 new clients to pursue a shrinking pool of healthcare resources. That's a little abstract. Concretely, that means overstretched healthcare providers who will have less and less time for each patient. The architects of the private option understood this problem, and they tried to solve it by putting expansion clients on exchanges. The exchanges pay providers better than traditional Medicaid does, so private option clients will get better access to care than they would have if they were on traditional Medicaid. But I don't think anybody ever thought this plan through. The way this will have to work is that medical providers are now going to have a strong incentive to give private option clients better access and traditional Medicaid clients less access. This leaves traditional Medicaid clients out in the cold. This means that the private option will create even larger barriers for access to the truly needed. It will be even tougher for the elderly and the disabled to get the health care that they truly need. The effect of the private option is to put able-bodied adults at the head of the line and push the neediest and most defenseless Arkansans to the back of the bus, and I cannot support that.